Yeah, it's also about finding a plan, and that has been one of the great difficulties in this, because there is this split in the executive that is becoming clearer and clearer. Listening to all of this is Adrian Huston, who's a businessman and tax consultant, and also the Andersonstown News columnist Andre Murphy. Good afternoon to both of you.
Hi, Chris.
Adrian, if we come to you first, you're listening to this. Do you have a great belief that actually a lockdown will make a difference? You know, it feels like something has to be done, doesn't it?
Yes, I'm absolutely convinced, Chris, that a lockdown will make a difference. It will ruin our economy. The economy is in a terrible state at the moment. We are not seeing deaths going up. So, yes, we're seeing lots of healthy students testing positive. We're seeing lots of tests being done. We're seeing lots of positives. We're seeing 4 times more tests being done every day than in June. But we're still at daily deaths of 0 or 1, all the way from June. So these have not changed. So what's happening is people are testing positive, but most of them are not getting very sick. The vast majority of them probably don't even know they're sick. They're like the students. If we do this again, the education will suffer if they close the schools. Businesses will be devastated. A lot of businesses will not recover from this because the government support is not going to be sufficient. Take an example. Well, Stephen Farry, and I would just like to take this opportunity to thank Stephen Farry for voting against the extension of the Coronavirus Act in the Commons. He's the only Northern Ireland MP who did vote against it. But Stephen Farry clearly pointed out the problem we have is, yes, okay, if you take, say, hospitality, you might be able to protect workers in a restaurant with government support. But what about the people who supply the linens to the restaurant, who sharpen their knives, who supply food to them, who do all the services? They haven't been told to close, and yet their income might drop, to 0 or 10% of what it used to be. And there are all these wider impacts of a big lockdown, which are just not justified by the numbers of people getting seriously ill and, more importantly, dying. People are not dying. We'll get into the medical figures.
We'll get into the medical figures in just a second. But on that point of whether or not we can afford, from an economic and societal point of view, another lockdown, Andre Murphy, do you want to respond to that?
Well, I think that what we have to see now, I think what Gareth Gordon was talking about to you earlier on, but really took my breath away anyway. We're 10 days away from being overwhelmed, but we can see it and we know it. People earlier on were talking about schools not being the problem, for instance. We already know that the schools are closing. Full schools are closing, whether it's for 2 days or many of the pupils are being sent home for 2 weeks. Last Friday in West Belfast alone, there were over 1,000 kids not in school with classes having to close. There were over 100 teachers isolating. That was one constituency. So you put that right across the board, and we are seeing that there are parts of our society are already grinding to a halt without us having a proper coherent policy in place that is going to bring those figures right down. And I absolutely get what Adrian is saying, that there isn't a comprehensive and coherent strategy to protect and incubate businesses. There's no doubt about that. But it's a Hobson's choice right now that we know that the ICU beds are starting to be filled right across the island. And even in the south where the rates are lower, we are seeing that those ICU beds are becoming populated. And we know that in a few weeks' time that is going to mean that the mortality rates are rising. And people aren't trying to, the chief medical officers are not trying to close down the economy for some sort of academic exercise. They're doing it because our health is at risk. And I think that when you were talking earlier on to Chris Hazard about messaging, I think that the messaging probably hasn't been great, because we've been told from maybe August, the beginning of September, we're on precipices, we're at crossroads, and people were nearly deaf to it because at the same time life had begun to open up and we were seeing life beginning to look a bit more like normal. But right now, with those kind of figures that Gareth was talking about earlier, I think that we are now in a moment of emergency, and something very different has to happen. We can't put our head in the sand and we can't just wish it was different, because it isn't. It just is something that is very serious and we need to get our heads into it. And the messaging around not going to house parties, putting on your masks, we've had weeks of that. and it hasn't made any difference. Now we're into the thousands every single day of those tests coming back positive, and we know that those ICU beds are being populated. We are in a state of emergency now, and we've no choice. We have no choice other than to do something very, very dramatic. And we have to make sure that there's incubation measures put in place for all of those workers, that they are protected and the businesses are protected as well.
Well, I want to pick up on that idea of a state of emergency because, you know, as you say, we do get these figures from the Chief Medical Officer, the Chief Scientific Advisor, that hospital beds are being taken up, that there is a real danger of the health service being overwhelmed in 10 days. And then we do also get these claims from the likes of Adrian that whenever you take a look at the death figures, they are still very, very low. Let's speak to Dr. Tom Black, who represents the British Medical Association. People are struggling to get this in their head. What is happening here? Is there a certain amount of a time lag in terms of the hospital beds filling up and potentially deaths? Or is Adrian Huston right in saying that people should be less scared of the virus this time round?
I think our big problem now is it's winter. We have been seeing far more cases. So in the northwest, which seems to be leading the way in terms of the second wave, we've had more cases of COVID positive in the last 10 days than we had in the previous 8 months. So that's a huge reservoir of infections now in the community. GPs have been really busy for the last 3 or 4 weeks dealing with that. Then there's a lag period in terms of when do you actually get severely ill, because the first week of the infection is like a cold or a flu. So you then have a lag period, and we're now starting to see the admissions going into hospital, and the GPs would triage them, sort them out mostly in the GP practice, then refer about 100 per day in Northern Ireland was the figure last week. It'll be higher this week into the COVID centres. They triage out most of those and don't send them into hospital. But as you can see, every 79 days the number going into hospital is doubling. We have 130, 140 in hospital with COVID at the moment, probably about 19 intensive care beds was the number yesterday, but that's them just starting to catch up with the GP workload. So GPs get it for 3 or 4 weeks, then the hospital wards will get it for the next 2 weeks, and then the intensive care beds will get it after that for the really severe cases. So we see this escalating. We know what happened last time, and we know that we're actually in winter as well. So in Derry over the weekend, we vaccinated 5,000 people in the schools with the flu vaccine, did the same the previous weekend. We'll keep vaccinating people because normally what happens is a lot of people catch the flu now and end up in hospital with pneumonia and in intensive care with pneumonia. There will not be the beds for those influenza patients.
And as you say, there are those winter pressures. But, I mean, Adrian, I don't know if you want to speak to Tom Black directly here, but, I mean, you are raising these questions about why death rates are remaining so low if the number of cases is rising.
Yes, I am absolutely. I mean, I'm obviously not a medical expert, but I have spent 35 years studying numbers, and you know, we do have the World Health Organization's Dr. David Nabarro saying that the leaders should stop using lockdown as their primary control method. We've heard about, I think it was probably 3 or 4 weeks ago, our Chief Scientific Officer was saying cases are soaring. I mean, at this time, obviously, they were much lower than they are now. Cases are soaring. We are going to see...
And he was right. They are soaring.
Yes, but this was about 3 or 4 weeks ago, and he was saying, we're going to see an increase in deaths. Well, it didn't happen. And I have no reason to believe it will happen in the future. You know, the deaths might go up a little, maybe to 2 a day, but we're not seeing anything like the rise in deaths that was reflected by the rise in positive tests. And of course, positive tests produce pressures for GPs and the COVID centres. But if we're worried about the NHS not coping, then we need to make sure that our Nightingale Hospital is ready to take the COVID stuff and leave the NHS to do the rest.
I suspect a lot of doctors will hope that you're right in saying that those death rates won't rise. But Tom Black, is that realistic?
Oh, I'm hoping Adrian's right as well. And, you know, I concede the point that this is mostly young people now. More than half the cases are under 40, the majority under 60. The problem we have here, Adrian, is that we're looking at seepage across the generations. And every time I go on the radio or TV, I say the same thing, which is do not visit your granny. Do not visit your aunt or uncle who are shielding or have asthma or COPD, because the seepage across the generations is the problem. The Deputy Chief Medical Officer in England this morning showed a graph of the northwest of England, because Liverpool, Manchester, the northwest of England is the other big area with the second wave, and they're showing seepage across the generation. So the young ones are going home and hugging their granny, and that just drives me mad. Please, if you're one of those young ones that's been socialising, even if you have no symptoms, don't visit your granny, don't hug her, and stay away from your cousins and uncles who are shielding or who have risk factors. That's the key to keeping a lid on this.
Tom Black, as we are speaking, Robin Swan is speaking in the Assembly, and we are keeping a watch on the Health Minister and what he's saying. And if there's anything important, we will, of course, bring it to you. But one of the things he has said, because we keep on asking for what the science really does say, we keep on asking for the information. And what Robin Swan has said is that the papers from the Chief Medical Officer and the Chief Scientific Advisor call for decisive action now. If that is the case, do the politicians have any excuse to do anything other than act?
I think what we have to do is follow the science, follow the data, and the Chief Medical Officer and the Chief Science Officer see all the collated data. So every day, every week in my practice, we would do returns on the number of COVID-type patients we have. The same for the hospitals and throughout the health service with respect to intensive care in the wards. So they see those numbers, they see the direction they're going, and they'll give the advice to the Minister, who's doing a really good job, and it's probably the hardest job in Northern Ireland at the minute. I'm sure he's worn out like everybody else is with this, but we just have to keep our head down and keep working hard at it.
OK. Tom Black, thank you very much indeed. Adrian and Andre are going to stay with us, but I wanted also to bring in Simon Hamilton, because the end of the month does see the end of the furlough scheme, and while there are other job support programmes being put in place, it is expected that there is going to be a large number of redundancies because of the damage already done to companies. And as Adrian has been suggesting, the idea of a further lockdown or even lockdowns is really worrying business leaders, including Simon Hamilton of the Belfast Chamber of Commerce.
I think there's grave concern across the business community, and obviously, there is an understanding, because everybody in business, whether that's in Belfast or wherever it is in the region, sees the spiralling number of cases of the virus. So there's not oblivious to the reality in terms of where the pandemic currently sits in Northern Ireland. But whenever they hear people like the Chief Medical Officer talk about our economy put back into sort of the restrictions that we were in earlier this year, that caused grave concern. Obviously, in terms of what the short-term impact, but the wider long-term impact as well. It's been a tough, really, really tough 6 months for businesses. Lots haven't survived. Many have kind of weathered the storm, come through, got themselves going again. We're starting to move in the right direction. We're seeing trade growth come back, footfall increase. And then the fear now is that not only would a 6-week or indeed any sort of duration of a lockdown cause significant damage to their business, but it would also inevitably result in tens of thousands of job losses, which are going to be incredibly hard to get those people back into work in an economic environment, the like of which we've never seen before, which would be, almost like back into the 1980s type of situation. So obviously, huge concerns, real worries, and a period of some uncertainty facing many businesses and many families.
I understand, and it's not just you. There are many people who say this is not a strict health versus wealth argument that's taking place. But at the same time, you're saying, let's protect businesses here. And what the warning coming from those in the health department is that the truth is that hospitals are going to be overwhelmed very quickly, that there is a real danger of ICU beds being taken up, and that actually this is going to be a question of lives. And protecting businesses at the extent of that is something that a lot of people will find very, very difficult to stomach.
And I don't think it is that sort of very, very binary choice that we face. The government, the executive, needs to take a long-term perspective on all of this. That's what we expect any government to do, is to look at the range of factors, both the short-term and long-term impacts. And there are health implications, there are wider societal implications of seeing large parts of our economy, entire industries almost go to the wall, as a result of further restrictions. That's going to do damage, which is going to be really, really difficult to
and I get that, and you've made the point, but you have been inside that tent. You have been somebody making these kind of decisions, and clearly this is pretty unprecedented for a Northern Ireland executive. But what would you be doing at the moment if you're not prepared to kind of close businesses down? What would you be doing to protect hospitals? What would you be doing to protect the health service?
I think the difficulty for those of us outside of that tent is that, and this is something that I hear pretty much every day now from members of Belfast Chamber, is that, you know, they aren't unappreciative of the need to do something, to take action, for the executive to make decisions, some of which might impact upon their individual businesses or upon the sectors in which they operate. But what they're not currently seeing, and this is why it's very, very difficult for those of us outside to say, answer that question and say, well, this is what I would do, rather than what the executive is proposing, or what people within the system, and particularly in the health department, are proposing, is that we're not seeing the evidence that relates the restrictions that are being imposed to the risk within certain environments. So a number of weeks ago, the First Minister said that business was not the villain. We were being told by a range of different people, both here in Northern Ireland and elsewhere, that transmission was happening much more at homes and house parties and social settings like that. It wasn't happening within the work environment, or certainly not in retail or not in hospitality. Yet something seems to have changed, or at least that's the impression you could come to, because hospitality in particular, if you look at what has been instigated in the Northwest, is now effectively closed down up there.
If you listen to the Chief Scientific Advisor, he was very clear that more than half of the cases in Derry and Strabane were related to hospitality. And so that has been a difference, and that is new evidence. I think, also, if you take a look at evidence, you can see, for example, from the information, that there is a huge increase in the number of people who are being hospitalised, a real concerning increase. There is a huge surge in cases, and you avoided the question, and the question is really simple. What are you prepared to do at this stage? What would you be prepared to do making decisions? Because the reality is, at one stage, you weren't even prepared to make face coverings mandatory in shops. You were writing letters to try to stop that. I know it's your job to kind of speak on behalf of business, but what would you be prepared to do to try to protect people's health?
I think the point I was making on evidence is that if the evidence was there and it was made public, and those businesses could see the correlation and the connection between the sector that they're working in and transmission of the virus, I think that would build confidence in whatever measures the executive ultimately decide to enact, either on that sector or more widely in the economy. But that thus far hasn't been communicated.
That's Simon Hamilton on the broader business problems from the Belfast Chamber's point of view. Let's take a look at it actually from an individual's point of view. Anna is on the line from Belfast. Anna, you have actually now self-isolating. You've tested positive for COVID.
I have indeed, that's right, yeah.
And that in itself, I'm sure, is a shock as well. But then there is also the implications of what it means to your household.
Yeah, that's it. It was a big shock, to be absolutely honest. But thankfully, I don't have severe issues. So, yeah, it's the effect of the household. So it's myself. I'm self-isolating. There's others in the house, my husband included. Now, my husband is self-employed. He has been self-employed for 35 years. He's built up a business. So he is now isolating. But to be able to find information as to what he's entitled to, is he entitled to anything, it's beyond. We have rang the benefits advice line, and that was useless, absolutely useless. Spoke to another person, one tells you job seekers allowance, one tells you universal credit, another tells you, oh, you'll not get anything because you work, your husband won't get anything. I don't understand where to go. We don't claim benefits, so we haven't a clue. You know, it's a mind.
Yeah, well, I mean, I don't know. Adrian Huston's still on the line. So, I mean, Adrian, you're a tax consultant and a businessman, but do you think it's easy for the self-employed, all of this? Do you know of what actually Anna's husband's entitled to?
No, absolutely not. I mean, he may have been claiming the self-employed support, which is still ongoing to the end of the month. But if he's been working away prior to his isolation, he probably wasn't claiming that. But he can go on to that. You don't have to have previously claimed it. But yeah, it's very, very confusing, and there are an awful lot of people who fall between the gaps and actually getting no support.
There's also, I was reading online, there was a £500 payment through the Test and Trace Support Payment Scheme, but it appears that's only in England. Does it not happen here? Why are we being treated differently?
Adrian, you don't happen to know that by chance, do you?
I do believe it isn't available here, and that's one of the more important questions our ministers could be addressing rather than trying to kill what's left of our economy.
Yeah. Simple things like that could keep people going, and they can go back out to work afterwards. It's just, why is it different in different places? And that's not helpful when you're trying to see what you're entitled to.
Anna, our heart goes out to you, and the one thing I'm just glad to see that the symptoms are not too bad. Look after yourself and look after your family. We'll try and get you more answers on that and try and push some of the politicians about that.